Hello friends, I'm back with another video. In this video, I will be talking about Asperger syndrome. Asperger syndrome is one of the types of autism spectrum disorder. In this video, we will be talking about what is Asperger syndrome, the causes, the symptoms, the treatments, and how is it to deal with Asperger syndrome. The children dealing with Asperger's syndrome, they often exhibit challenges relating to their peers, making friends, reading social cues, respecting boundaries, sharing, and taking turns. Now, what is Asperger's syndrome? It is a neurobiological disorder that is included in the ASD. It is characterized by communication difficulties, social impairment, and restrictive repetitive behavior patterns. It can also occur on the severity and the symptoms of this disorder can occur in a number of different combinations in each child. Two children with the same diagnosis, they might share the same behavioral patterns, but they may display range of abilities and skills. Some people who have ASDs, autism spectrum disorder, are severely disabled and require substantial support for activities of daily life. Asperger's syndrome, however, it is considered to be the mildest form of ASD, and those who have Asperger's syndrome are considered to be on the higher functioning level. It can be diagnosed at the age of 2, but as soon as it is diagnosed, there should be a treatment plan ready. So, the treatment plan should be built upon the child's interest. It should follow a predictable schedule and actively engage the child in a structured activity and provide regular reinforcement of positive behaviors. Some children with Asperger's syndrome, they might benefit from social training to teach appropriate peer interactions, cognitive behavioral therapy to teach emotional regulation, and medication as needed if there are any other co-occurring disorders. But with effective prompt treatment and support, most children with AS are able to overcome the many challenges associated with the disorder. Now, what are the causes? Like I said in my earlier video for autism spectrum disorder, the main cause is genetics. It is nothing different here. So genetics is one of the leading causes. Next, there are some physical causes. Some brain imaging studies, such as MRIs and CT scans, they have shown that there are structural and functional differences in specific areas of the brain of those affected by Asperger's syndrome. Then there are physical, environmental factors too, like prenatal complications, air pollutants, viral infections. These all lead to Asperger's syndrome along with a mother's, lifestyle. Now, the signs and symptoms. So, there are many signs and symptoms related to Asperger's syndrome. The behavioral symptoms. So, children, they may seek out but will have difficulties in making friends or interacting with peers. Excessive talking, especially about a specific topic, they might have interest in one or very few specific topics and they might only talk about them. Then frequent one-sided conversation. They might not even realize that the other person is not even listening to them and they go on talking about the topic which they like to talk about. Then lack of interpersonal relationship skills and interest, inability to express their own feelings. Then they might often verbalize their internal thoughts. If they are angry about something or they are thinking too much about something or upset or happy, they might verbalize it. There might be echolalia too, like repetition of like saying a certain word or one word over and over again. Then lack of empathy. They might appear to have lack of empathy, but it is their difficulty to express themselves that shows them as like non-empathetic. So if they are playing on a playground with a peer and the peer falls, they might not run to the peer and check on the peer, but if taught, then they might do it. So there might be difficulty in expressing their feeling, but uh, it's not that they are not empathetic. Then inability to understand societal norms, like you shouldn't talk loudly when you are going to someone's house, you shouldn't sit there, shouldn't touch that. They might have difficulties in understanding those. They may not make eye contact while conversing, and they also may not understand the concept of personal space. For example, if their friend is drawing something or writing or building, they might just get on the friend and try to see it. It's not that they are disrespectful, but they don't understand the concept of personal space. Then there might be some physical symptoms too, the poor fine motor skills, poor handwriting, then like highly sensitive or overstimulation to loud noises, music, bright lights, unusual textures, or strong taste. Then there might be poor coordination, clumsiness. This you might see very often, clumsiness. Then unusual body postures and gestures, difficulty using gross motor skills that is needed to learn to ride a bike. Then there might be some cognitive symptoms too, tremendous difficulties with changes in routines or schedules. They may have one or very selected interest and they are extremely knowledgeable about that. Then like difficulties picking up on these subtle changes in tone, pitch of voice. So if you tell them something, you might not be like trying to be mean or like trying to be angry, but they might not understand the tone or pitch. Or suppose you are actually like being stern, like keep your book right now, they might not get the pitch of it. So it might take time. Then unable to understand jokes or sarcasms, their brain, they cannot see anything, like think anything abstractly. It's always like the literal meaning for them. What they see is what they know. Lack of inborn social skills, like taking turns, sharing, or having conversations with others, letting others speak of their topic of interest too. Poor organization skills, this is one another thing that you might see a lot. Now, along with so many behavioral, cognitive, and physical, struggles, there might be some psychosocial symptoms, that is low self-esteem, low confidence, tendency towards shyness, loneliness, anxiety, depression, moodiness, a feeling of being unlike his or her peers. So these might be some of the signs and symptoms. Now, can Asperger's syndrome person have a normal life? So yes, with the right treatment, people with Asperger's, they can learn how to control some of the social and emotional challenges that they face. Does Asperger's get better with age? Asperger's syndrome is lifelong, but of course, symptoms tend to improve over time. With the proper treatment, therapy, and support and help, the person will learn to understand their own strengths and weaknesses, and they will learn to improve their social skills. Now, treatment, there might be some therapies, and then self care management, and of course, in certain cases, along with all this, if medicine is needed, the doctor will refer. There are many therapies like the support group. It is a forum for counseling and sharing experiences among people with a similar condition or goal, such as depression, or the struggles that they are facing. Then there are cognitive behavioral therapies, that is the talk therapy, which is focused on modifying negative thought behavior. and emotional responses, then anger management, then there are education about mental health that also serves to support, validate, and empower patient, then family therapy, then the ABA, which is applied behavior analysis. It is a teaching method that helps autistic children learn socially significant skills by encouraging positive behaviors. Okay, so these are some of the therapies that might work. Now, one more thing which I would like to address in this video is I have always heard a term that which is referred to our kids, our special ed kids, is socially awkward. You know, in my years of teaching and experience, I never understood what does it mean to be socially awkward. You know, for me, I take time to open up. If I'm going to a get together or anywhere where I don't know many people, I would just sit in a corner, be with my phone. If I have my family there, definitely I would talk to my family, but I would not talk to many people. Yes, if someone is greeting me, I would greet that person too, smile, but not that have a conversation until I know that person. So I don't know, like whether I am socially awkward. Then in some parties, I have seen people who are very much social, you know, they will actually go to every person. It doesn't matter they know them or not. They would go, they would start a conversation, they would be friends. Uh, Now some people would think, oh my god, this person is like too much, like asking for my phone number and like wanting to be my friends or calling me over for a dinner or something, you know. So are they socially awkward or our kids socially awkward? It's a very important question, you know, that what is it to be socially awkward? Because I think that every person is different. Their way to interact, their way to socialize is different. Um, their likings, their dislikings is different. So, what is actually to be socially awkward? So, yes, that is it for this video. Please share with the ones you know would benefit and like my video. If you know anything more about Asperger syndrome or anything that is under autism spectrum disorder that anyone would benefit, please mention in the comment section. And yes, I'll come back with another video. Bye for now.